to week 4. This week our main focus is going to be on blood collection. With that being said, I really want you guys to focus on and read Chapter 4. This chapter will help you better understand the process of collecting blood. This week we will be moving out from those artificial arms in the back of the room to practicing on our partners. So I suggest that prior to class you guys make sure that you not only get the materials, read the materials, but also make sure you eat and drink plenty of water before you come to class. So let's get started with what is blood collection. What that means is you're going to cut into a vein to extract blood for testing. Another name for this, as we well know, is called phlebotomy. Now, before you can understand how to really collect blood, it's essential that you understand how your blood vessels work and what the structure of those blood vessels are. Blood vessels are part of our cardiac system. This means that they are part of a closed circuit unit and a closed circuit function. That means that the blood vessels carry blood away from the heart to the rest of the body, and then from the rest of the body back to the heart. This is how your blood will recirculate itself, not only throughout our bodies, but throughout our heart as well. It's important to understand that all blood vessels have a specific thickness, and they also have 3 layers. They have an outer layer, a middle layer, and an inner layer. So now that we have that understanding, we understand that it is a closed circuit, let's discuss the different types of blood vessels that you have in your bodies. You have arteries, arterioles, veins, venules, and capillaries. So let's talk about each of those a little bit more and how they function. So arteries are the first one. They are the main functioning unit that carry blood away from the heart. Arteries do have a pulse, and this is something that we have talked about in the past, not only in this class but in prior classes as well. Arteries are generally thicker than other types of blood vessels, that's why they feel a little bit harder. And they're more elastic-like, so they're more rubber band feeling as opposed to veins that are more bouncy ball feeling. Arterioles break off of our arteries. They're the small branches that break off of them. They then further break down, and they break down into our capillaries. Capillaries are what we can find in the ends of our fingertips, where we actually collect capillary samples from. Capillaries are more arterial blood than they are venous blood. That's why they have that brighter red color to them. Capillaries break down further into venules, and then those venules combine to create your veins. Now when we talk about veins, their main function is to carry blood back to the heart from the rest of the body. Like I stated earlier, they feel very spongy, much like a bouncy ball. I also want to talk a little bit about what the composition of blood is in arteries versus veins. So your arteries and capillaries will have that bright red color to them. The reason that is they have more hemoglobin, which gives it that color. So the hemoglobin factor will give it that bright color. Where your blood in your veins, or your venous blood, will appear a little bit darker, deeper red in color. This is because venous blood has more calcium, potassium, and total protein in it. So that being said, when you do documentation for a blood draw, you always want to be very specific where the blood came from. Was it a venous draw? Was it a capillary or artery draw? Because that will actually alter results in some cases. So you want to make sure that you give the most accurate documentation you can. Alright, let's get into some more of the fun stuff for today. So the most common veins that we use for venipuncture are found in what we call the antecubital space. That is the bend in the elbow. Okay? So when you do this, and I'm just going to roll up my sleeve here so you guys can see, there are 3 main veins in that space. You have your median cubital, your cephalic, and your basilic. Now, median cubital is the most commonly used vein that you should be using, just because of the simple fact it is the most anchored into your antecubital space. It doesn't have a whole lot of moving room, a whole lot of wiggle room, where the other two will. The median cubital is found right in the center of your antecubital space, so right in the middle. Okay? The second most commonly used that we try to use next would be our cephalic vein. Now, the cephalic vein is located on the thumb side of your antecubital space. It is the second best choice due to the fact that it is pretty anchored, but not as well anchored as your median cubital is. So if you take your two index finger and middle finger, start at your thumb and run your fingers upward to your antecubital space, you should be able to find your cephalic vein. And the last vein that we have is our basilic vein. Now, this is what I like to call the last resort option for venipuncture. Due to a couple of facts, it's really poorly anchored and it will roll around on you. Another factor is the fact that underneath your basilic vein is your basilic artery. And if you go too deep or you don't perform the procedure correctly, you could nick that artery. And nicking the artery could cause severe damage to the patient and a lot of pain. Your basilic vein is located on your pinky side. So again, index finger, middle finger, from the pinky all the way up, you should find that. Now, it'll be easy to find because if you press down on your basilic vein, you should feel the pulse of the artery below that. With that being said, I always want you guys to know that you should try to find the best vein within the antecubital space. Yes, the median cubital is the number one that we want you to use, but go for whatever one feels the biggest and the most anchored for you. Alright, so we've discussed how blood works, how it functions through the body. We've talked about your blood vessels. We've talked about where to draw blood from. But we want to talk about some of the equipment that you will use when you are drawing. Now remember, if back in week 1 I talked about the most important piece of equipment you need is that requisition form. And again, that's just that order form that the doctor gives the patient, and it comes to you as the phlebotomist or the CMA as what blood work he would like done and how he would like that done. Let's also talk about the different methods of blood draw. So there are 3 different methods. You have your vacutainer tube method, your butterfly method, and your syringe method. Now, I'm only going to focus on the vacutainer method because that's what we will be focusing on and working with this week. It's what you guys have been practicing on the artificial arms up to this point. So, if you remember, when you do this method, you use a vacuum tube. Now, that tube is something that you've been playing with in class. They do come in different shapes and sizes and colors. But what you may not know is how that vacuum is created. So what happens is they actually remove the air from the tube, which creates that vacuum. And it will only allow as much blood to come into the tube as there was taken out. Now, I said that they range in different size and color. When you're dealing with the sizes, for adults you want to use tubes anywhere from 2 to 50 milliliters. But for children you want to stay smaller, only 2 to 4 milliliters. The top colors can be a range of any rainbow of colors, and those colors represent the different additive or anticoagulant that is found within the tube itself. I am not going to go into what every tube has in it, so please make sure that you review that in your book. It does a very great job of breaking that down for you. Your vacuum tubes can also be glass or plastic, but because of safety regulations, OSHA really prefers that you have the plastic because they don't break as easily and they don't cause any harm if broken. Also, for this procedure, you will need a double-sided needle. That means that there are needles on both ends. The shorter one being the one that punctures the tube and is covered with that gray sheath. The longer side will puncture your patient. In order to make it so the tubes can connect on, you need a plastic hub, which is that clear piece that you twist the needle into. And the last piece that I really want to talk about for you guys is the importance of the order of draw. The reason it's so important to make sure you follow the correct order of draw is because if you don't, you have cross-contamination of the additives and anticoagulations that give us our false results. So when you are drawing a rainbow, you always want to start with your blood culture bottles if you have them. Now, if you don't have blood culture bottles, a pale yellow-topped tube can be a substitute. The next will be a light blue-top tube. This is used for our coagulation studies. And when you use those tubes, you need to make sure that you fill them completely. Next comes a plain red-top tube. This should be a tube with no additives in it. It's normally a waste tube, but you can also use it for any sort of specialized testing. Green comes next, and that is going to be used for chemistry or serology studies based on what is on the inside of the tube. Lavender will be used for your hematology studies. And the last tube that you will use is a gray tube, and that is used for your glucose testing. Alright guys, that is really all I want to talk about for the video today. As always, I will have all of the materials printed for you prior to class, so you do not have to do that. It is still your responsibility to read the chapters, okay? Please make sure that you also watch the video found in your discussion post, because that does help you understand blood separation as well as centrifuging, which is what your discussion post will be on this week. As always, your initial post is due Tuesday by midnight, with your 2 responses due Saturday by midnight. If you guys have any questions, please bring them to the lab. I look forward to seeing everyone on Thursday. Have a wonderful week, guys. Bye-bye.